Namaste everyone. So today we are going to learn about who should avoid or modify yoga practices. Yoga is generally safe and beneficial for most of the people when practiced correctly. But there are certain individuals who should exercise caution or avoid specific types of yoga practices due to health conditions or circumstances. For example, if you have a student with severe heart condition, such as advanced heart disease or recent heart surgery, a vigorous style of yoga, such as Ashtanga yoga or hot yoga or a hard vinyasa flow, arm balancing, peak poses, those are going to put a lot of strain on the cardiovascular system. So, a person should, with a recent heart attack should avoid strenuous yoga poses. Instead, they should do something gentle like a restorative yoga or a yin yoga, but only after the doctor gives them a clean bill of health. Severe osteoporosis. Individuals with osteoporosis have weakened bones and have a high risk of fracture. So they should definitely avoid poses like the Paschimottanasana or intense twisting poses. Glaucoma. People with glaucoma, which is a medical condition that puts pressure on the eyes, they should avoid poses that like headstands or handstands that actually increase the pressure on your eyes. Hypertension. Individuals with high blood pressure should avoid poses that involve significant inversions or vigorous movements that can elevate the blood pressure. For example, a person with hypertension should avoid poses like a handstand or a hard vinyasa flow class. Recent surgery or acute injuries. Students who are recovering from recent surgeries such as abdominal surgery, joint replacement, knee surgery, hip replacement, especially spinal surgeries, should avoid yoga until they get a clean bill of health from their doctor. Pregnancy. While prenatal yoga is generally safe and beneficial, pregnant women should avoid certain poses like deep twists, intense back bends, especially during the later stages of pregnancy. Severe mental health conditions. Acute psychosis or severe psychiatric conditions. So, individuals who experience acute psychosis, schizophrenia, or bipolar disorder, they should avoid meditation and intense yoga practice without professional supervision, because when you're doing yoga, mindfulness, meditation, pranayama, it does release a lot of emotions, and if the emotions cannot be handled with maturity, then there are a lot of problems that can happen. Severe anxiety or PTSD. Some individuals with severe anxiety or post traumatic stress disorder may find certain yoga practices, especially meditation, to be very triggering. So, always make sure that when you're teaching a meditation class, that the students who are there, if they have certain tendencies, as a yoga teacher or as a meditation teacher, we should be aware of that. Individuals with spinal conditions, and from personal experience I can tell you that lot of students are going to be having spine conditions, herniated disc, bulging discs, locations, severe spinal issues. So in these types of situations, there are certain poses, especially forward folds, deep forward folds, deep twisting, deep back bends. They can aggravate the condition, and slowly, it is going to be extremely painful for them. There are students who, in spite of having spinal issues, continue practicing yoga, and over a period of time the conditions gets worse and worse. So anytime a student comes and tells you that they have spinal issue, always ask them to go back to their doctor, get a clean bill of health, and get a okay from doctor to practice yoga. And even if they do practice yoga, they should, like for example, make certain modifications like use blocks, use straps, do not stress the spine too much. For example, when you're doing uttanasana, forward fold, ask them to not stretch the spine too much but bend the knees. That will relieve the stress on the spine, things like that. If they are doing a pigeon pose, ask them to sit on a yoga block, so that will be helpful. High risk individual for certain inversions, cervical spine issues. Individuals with neck problems or cervical spine issues should avoid putting pressure on the neck, especially headstands, shoulder stands. Uh, when we are doing shoulder stands, always remind students that there should be zero stress on the neck, because the entire load is being carried on in a shoulder stand on your shoulder blades and your elbows. No stress on the neck. Individuals with severe balance issues, there are going to be a lot of students in a class who just cannot balance. They have vertigo, dizziness, and conditions that affect their hand eye coordination that is needed for a body to be in a balanced pose. So make sure that you give them proper props or help chair to get them into the poses. Children and elderly. Yoga poses typically are good for children and also for elderly, but there are certain poses that we should avoid when you're dealing with children that might prevent their injury. The practice should be fun and simple for children. Elderly individuals, definitely when there are senior citizens in the class, have that cognizance as a yoga teacher. Avoid like giving difficult poses like headstands, handstands, arm balancing. That might push the students into trying to try the pose and get injured. We don't want that to happen. So simple stretching is good enough. A gentle flow, a gentle vinyasa flow, a gentle hatha flow, a slow and easy flow that is recommended. People with specific medical devices like pacemakers or other implants, they should avoid poses that put pressure directly on the area of the implant or interferes with its function. Infectious disease and illnesses. Individuals with like infectious diseases, they should avoid going to group yoga classes, because you definitely don't want to spread the disease, prevent the spreading the illness to the other students. So practicing yoga when sick with conditions like flu or severe cold, it can also worsen the symptoms, and also it delays recovery. Namaste and thank you.